Good afternoon and welcome. We will call to order the House Health Subcommittee. It's Tuesday, March 19th, the year 2024. Ms. Adams, will you please call the roll?
Representative Hicks, Jernigan, Leatherwood, Martin, Mitchell, Sherrill, Terry, Williams, Chairman Hawk.
I am here.
You have a quorum.
Chair detects a quorum. We are prepared to do business today. We have a substantial calendar and lots of work ahead of us. Personal orders by any committee members as we begin? I do have one. We have our doctor of the day today. Dr. Randall Dabbs is with us. He has been an emergency medicine specialist from Loudoun County for several years. He's told me if I get hurt anywhere in the country, I've got a place to go. So, Dr. Dabbs, thank you very much for being our doctor of the day. He's good friends with an old friend of ours, former Representative Jimmy Matlock, as a matter of fact, so from Loudoun County in Lenore City. Ladies and gentlemen, we do have a calendar before us. We are looking at item number 36 on our calendar. We have a bill, item number 36, House Bill 2298. I think there may be a request from the sponsor.
Thank you, Mr. Chairman. Members, there's much conversation related to this bill, and as that conversation continues, at a request, we take this off notice.
Okay. As we've heard, there are lots of good conversations going on with this piece of legislation. Without objection, item number 36, House Bill 2298 is off notice.
Thank you, Mr. Chairman, committee, and Chairman Jernigan.
Thank you. All right. We are going to go as expeditiously as we can through the calendar, beginning back at item number 1. We have item number 1 on the calendar, House Bill 2899. The request has been, and forgive me if I'm wrong on this, Dr. Kumar, Chairman Dr. Kumar, the request will be to roll this bill to the heel of the calendar. Is that accurate? Yes. All right.
Thank you.
House Bill 2899 is rolled to the heel. I will mention at this juncture that, as Chairman Terry had announced on the House floor last night, that we will be working as expeditiously, I think I've said that 3 times now, as we can through this particular calendar, through this particular meeting. We will have House Hearing Room 1 after Full Health Committee tomorrow. Full Health Committee will begin at 3:30, and we will go through the calendar of Full Health Committee tomorrow. House Subcommittee on Health will convene after that, and we will work through as many bills as possible on the time that's given after Health Committee full tomorrow. It is quite likely and quite possible that we will additionally meet as some of these bills are moved to the Hill. Quite possible that we will have another meeting of this particular subcommittee, but that's still yet to be seen, but it is quite likely. With those announcements, we will now go forward to item number 2 on our calendar, House Bill 2908 by Chairman Dr. Kumar. Do we have a motion? We have a motion. You have a second. You are recognized, sir. I believe we do have an amendment on that bill.
Mr. Chairman, what number do you have for the bill?
I have drafting code 015381.
Yes, sir, that is correct.
Chairman Kumar, that is my fault. I misread the House bill number in the beginning. So we are on House Bill 2902. House Bill 2902, just for clarification, as we brought that bill up. And the amendment on that bill is drafting code 015381 to make sure we have all the numbers.
Yes, sir, that is correct.
Right. Let's go ahead and place this amendment on the bill so the sponsor can address it in its full form. All those in favor of placing that drafting code amendment 015381 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended. You're recognized, Dr. Kumar.
Thank you, Mr. Chairman and committee. In 2023, the General Assembly passed legislation requiring informed parental consent for all vaccinations until a child reaches the age of 18. The legislation further required that children in state custody could not receive a vaccination until informed parental consent from biological parents is obtained. This created some practical problems in the sense that Granny just could not take her grandkids for vaccination from the doctor that they usually did because consents have to be obtained and registered. And certainly created a major situation with children in state custody with DCS. There are almost 8,000 of those children. Their biological parents are not easy to find. That's why they are in state custody. Some are incarcerated, some are just not interested at all. And it created a lot of difficulty in getting these children vaccinated. And imagine 8,000 trips to the courts to obtain proper consent. And that process does need to be simplified because these are vulnerable children with enough custody problems, and they should definitely be protected against common childhood diseases. This bill is meant to correct those difficulties and find a reasonable way that still maintains the spirit of the law and honors the spirit of the law that was passed last year. The parental consent as well as parental definitions need to be again clarified. This bill asks that once a parent signs a consent with the physician or their healthcare provider, that consent is good for until the child turns 18, and unless canceled or withdrawn. Secondly, this bill says that children who were in state custody prior to passage of the 2023 legislation should be grandfathered in, and their vaccination continue just as it was continuing prior to passage of the 23 law. This bill also allows for a trusted adult to be able to come to the healthcare provider's office to get treatment and vaccinations done. We also have defined simplified the definitions and clarified matters regarding what is consent, informed consent, or a parent. Thank you, Mr. Chairman. I'll be pleased to answer any questions.
Thank you, Dr. Kumar. Any questions or comments for the sponsor? Chairman Leatherwood, you're recognized.
Thank you, Dr. Representative Kumar here. Had the opportunity to speak with some of the stakeholders and then with you very briefly for the bill. I do have some concerns with the bill in section 3. Let me say the things you described, adding the state custody is good and defining parents is good. But in section 3 of the bill, where it deletes subdivision 1 and 2 and rewrites them, all it does in the rewrite, everything stays the same, except it drops out informed consent in at least 3 different places I see. And I think informed consent from the parents is important. Why would we not want to have informed consent?
I agree with you. Sorry.
Chairman Dr. Kumar, you're recognized.
Right. I agree with you. And I think the reasoning was that a lot of times these consents are obtained by electronically on a healthcare facility portal. And for that reason, consent was a simpler definition, but no, there is no effort that consent should not be informed consent. And we can look into it and adjust it if we need to.
Well, and I know there are always stakeholders involved in these processes. would you be open to leaving the informed consent in there if we move it forward? If we move it forward, will you put the informed consent back in, or should we maybe roll this next week and be able to look at it a little bit
think-
more?
No, we are definitely open to that, and we want this to be the right thing. These are important matters. I will be happy to speak with your stakeholders, and mutually we can reach an understanding and see what's involved in that. And I think we can do it with the pleasure of the committee. We can do it on way to the full committee if we advance it for now.
And and I appreciate that, and I would hope we could do that. Just pulling out that one word, there must have been some reason for it, and I think it should stay. In section 4 of the bill, where it deals with all future vaccinations, and this is a new subdivision, so we're not changing verbiage in the existing law, but it says a minor's parent or legal guardian who provides consent for all future vaccinations does not have to be present, whatever. But it goes on, consent for future vaccinations is valid until revoked in writing, including in writing transmittal electronically by a parent or legal guardian. So it gives, it spells out how consent will be revoked in writing transmitted electronically. All that's fine, but it doesn't say how the consent will be given. And again, this is in that section, it doesn't do that.
Again, this is consent when given upon a website or a portal, and so they are not physically present in the office.
Mm-hmm. Sorry. In the definition of consent, it says means written or verbal, so they could in writing or verbally apparently give their consent for future vaccinations, but to revoke it, it has to be in writing. It just seems like it should be the same standard when you give the consent and when you take the consent away. To me, should be the same standard.
Recognized.
I think the idea is to make it most practical that we can and make the process easiest that we can. I don't have a particular strong feeling about it. I think that either way will be fine, and we can again talk to your stakeholders and work it out.
You recognized.
Thank you.
Further questions or comments of the sponsor of the legislation? Are we ready to vote? All right, I think we're ready to vote, and there would be a level of comfort from the subcommittee chair that you'll work through the full chairs committee to address Chairman Leatherwood's concerns. All those in favor of sending House Bill 2902 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and committee. I really appreciate your trust and will try to live up to it.
Thank you very much. You are also recognized on item number 3 on our calendars, House Bill 2914. Do we have a motion? We have a motion. We have a second. You are recognized, and I believe we have an amendment on this bill as well, Dr. Kumar. I'm showing drafting code 015624.
Yes, sir.
Yes, we have a motion. We have a second. We'll go ahead and put the clerical correction amendment on the bill. All those in favor of placing amendment drafting code 015624 on the bill, please signify by saying aye. Aye. Any opposed, please say no. All right, your bill is amended. Chairman Dr. Kumar, you are recognized on House Bill 2914 as amended, sir.
Thank you, Mr. Chairman. last year we passed a bill that allowed international medical graduates to apply for a job at a training program in Tennessee. And upon securing that job, after they are evaluated and their credentials are confirmed, and the fact that they have worked 3 of the last 5 years in their home country as physicians, we made it possible that after that they could apply for a visa as well as apply for a temporary medical license to come to the state of Tennessee. And if those things are granted and they come and work for 2 years under supervision in that medical center, then they are entitled to a full unrestricted license. That is what we passed last year. However, the sequence of securing a job, getting a visa, applying for a license, and working for 2 years under supervision, that needed to be clarified a little. And that is a bill that I passed in this committee 2-3 weeks ago, and it is now awaiting calendar and rules. Because there were other situations that the Board of Medical Examiners wanted to modify it, and it opened a different code of the law. For that reason, this is also a cleanup, second cleanup, so to speak, to the same bill. What this does is that it clarifies the sequence, and the Board of Medical Examiners, our Board of Medical Examiners suggested that we make the training that this person has in their home country to 3 years of postgraduate training, rather than just 3 years of practice. And the other thing they want to do is, instead of saying that a person, after they have gone through all those 6 steps and worked for 2 years in a satisfactory manner at a medical center in Tennessee, and that was to qualify them for receiving an unrestricted license, instead of saying they shall receive it, the Board of Medical Examiners wants to change it to they may receive unrestricted license. I think they want to give themselves a little leeway and be more prudent about it, because it's a major responsibility on them. I am agreeable to that, and with that, I'll be pleased to answer any questions.
Thank you. You've heard the bill explained as amended. It's a cleanup to the cleanup, so we like to
That's right.
we'd like to keep things clean, Dr. Kumar. Any questions or comments for the sponsor? Question's been called. All those in favor of sending House Bill 2914 to full Health Committee as amended, please signify by saying aye. Aye. Any opposed, please say no.
Thank you, Mr. Chairman.
The
and
ayes have it,
committee.
your bill moves forward.
Thank you.
Thank you, Chairman Kumar. Chairman Williams.
Chairman, I received a text from Chairman Vaughn. He asked that all his 3 next bills be rolled to the hill as he's in other committees, if that's okay. And if we can take him back up when he comes, that'd be great. 3, 4, and 5. I mean, 4, 5, and 6.
We have received similar communication from Chairman Vaughn. The only difference is on item number, and I'll go through the process. Item number 4, House Bill 2011. Request has been to roll the bill to the heel without objection. House Bill 2011, item number 4, rolled to the heel. Item number 5 on our calendars, House Bill 2093 has been requested to roll to the heel without objection. Item number 6, we have received a request to take that bill off notice. I'm going to double and triple check. The request has been item number 6, House Bill 2663, to be taken off notice as per request of the sponsor. Without objection, House Bill 2663 off notice. We're now on item number 7 on our calendars. And as I feared, many moving parts in the committee today, Representative Martin has had to step out to run a bill in another committee. We will roll him until we see him again. Without objection. We're now on item number 8 on our calendar, House Bill 2318 by Chairman Williams.
Thank you, Chairman and
Recognize.
members. House Bill 2318, I bring this on behalf of the Tennessee Medical Association and Coalition for Collaborative Care and support from the Tennessee Academy of Physicians Assistants, who have all collectively worked together to draft this hybrid model-based compromise for base care legislation. This bill is a response to numerous ongoing debates spanning more years than we've ever been up here, probably, Chairman. And the scope of practice for physician's assistants and advanced practice registered nurses in Tennessee. This amendment strips out the APRNs, which is at the request of the Tennessee Nurses Association. The bill creates more autonomy for endorsed PAs who have completed 6,000 hours of postgraduate clinical experience, which will increase care options across the state while also ensuring that trained doctors maintain collaboration to ensure the quality of care is not jeopardized or lost. Furthermore, this bill brings flexibility to a PA's ability to prescribe Schedule 3 through 5 controlled substances. It lays out a scope of practice for PAs, including the diagnosing and treatment of healthcare issues. It allows PAs to perform minor surgical procedure. It also allows a PA to assist a physician for level 2 or level 3 office-based surgeries. It allows PAs to sign death certificates, but it does prohibit PAs from advertising as a practice of board-certified medical specialty. Nothing changes for PAs with less than 6,000 hours of postgraduate clinical experience, and this bill does not deal anything or make any changes to APRNs. With that, I'm happy to answer any questions the members may have.
Thank you. And I will, and forgive me for not approaching you before this moment, but I understand you've got an amendment, drafting code 16712. And that unfortunately did come to us after the time frame. And that is a substantial amendment that may have some bearing on the legislation. You recognize Chairman Williams.
Yes, sir. If you want to roll with me to the Hill, I think if we do meet tomorrow, that committee deadline would be met. So my apologies on outrunning the chairman.
No apologies at all. I'm thankful for the explanation. And again, as we mentioned at the beginning of the meeting, due to the timing of the amendment and the ability to meet tomorrow afternoon, I will accept the recommendation that we roll House Bill 2318. I'm going to say to the Hill, but it may be tomorrow as we can accept amendments as we move. But at the moment, the motion will be to roll House Bill 2318 to the Hill. Without objection, that bill is moved to the Hill. Thank you very much for your explanation, Chairman Williams. You're now recognized on item number 9 on the calendar, House Bill 2316. You're recognized, sir. Have a motion? You have a motion. You have a second.
Thank you, Chairman and members. I do have a timely filed amendment for this bill.
It is a beautiful amendment. I think
Yes,
it's drafting code 015750. Would that be it?
Yes, it's it.
All right. We have a motion on that. We have a second. Let's go ahead and place that amendment on the legislation. All those in favor of placing House Amendment number 1, drafting code 015750 on the bill, please signify by saying aye. Aye. Any opposed, please say no. Your bill is amended. For your explanation, sir.
Thank you, Chairman and members. In 2022, the Senate sponsor and I passed a bill that authorized, under TCA, authorized healthcare facilities to employ post-commission certified police officers to provide security and law enforcement at facilities. Prior to that, we also passed a bill to allow for third-party security companies to provide those similar services to higher education. What this would do would put higher education and healthcare in the same posture as it relates to those certified security officers. With that, I'm happy to answer any questions the members might have.
Thank you. You've heard the explanation. Any questions or comments for the sponsor? Seeing none, you ready to vote? All those in favor of sending House Bill 2316 to full health committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. We're now on item number 10 on the calendars. House Bill 2645 by Chairman Leatherwood. Chairman Leatherwood, you are recognized, sir.
Thank you, Mr. Chairman and
Do you have a motion?
committee.
We have a motion. We have a second. You're recognized. I think we may have some amendatory
Amendment.
language there.
Yes, sir. 015479.
All right. I have a motion and a second on amendment drafting code 015479. Let's go ahead and place that on the bill. All those in favor of placing that amendment drafting code 015479 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You're recognized.
Thank you, Mr. Chairman and committee. This bill just makes some changes in the issuing of birth certificates in regards to adoption. The process can be very different with non-adoption. Just have a child at the hospital. I think it can take 5 to 10 days to get a birth certificate. If you finalize an adoption process and get a new birth certificate, can take up to 6 months. So this bill is just trying to streamline the process that has to be taken to get to that point, as well as setting some time limits in there as well.
Thank you for the explanation. You've heard the explanation. Any questions or comments of the sponsor? Question has been called. All those in favor of sending House Bill 2645 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. We are now on item number 11 on our calendars, House Bill 2451 by Chairman Leatherwood. Do you have a motion? Motion. We have a motion. You have a second. You are recognized. I think we have a far-reaching and substantial amendment to this piece of legislation. Drafting code 015096. Is that accurate?
Yes, sir.
Let's go ahead and place that amendment on the bill if we could. Motion and a second. All those in favor of placing amendment drafting code 015096 on the bill, please signify by saying aye. Aye. Any opposed, please say no. Chairman Leatherwood, you are now recognized for a bill that affects every practice of medicine in the state of Tennessee. You're recognized, sir, in a good way.
Other than that, it doesn't do
Other than
much.
that, it does nothing.
And
So
if
you're
I
recognized,
could-
Chairman Leatherwood.
Thank you, Mr. Chairman. If I could combine some out-of-order personal orders with the legislation. This bill actually comes to me from someone, I don't actually know if he lives in my district, but he lives in my neck of the woods regardlessly, and he's here, Dr. Woodbury, a dermatologist from Shelby County, became aware of some circumstances, and there he is right there. And I forgot to tell you that we signed you up to testify here as well. He went with the flow on that pretty well. But actually, this is a pretty simple bill. It just deals with providing accurate information to patients in advertising. And it just states that if a provider is using specific specialties in their advertising, that they should actually be qualified in those specialties. So, if somebody's holding out advertising dermatology services, they should be trained and licensed in dermatology. So just really a pretty common sense, logical bill, and appreciate y'all's support with that. Take any questions.
Thank you. We do have Dr. Woodbury on the list, but if there are no substantial questions from the membership, just to move forward, we may thank Dr. Woodbury for his attention and his attendance as well, and we may move forward. Any questions of the sponsor? You ready to vote? All right, thank you for this bill. I appreciate the willingness to amend legislation. Early on, we had heard from a few medical practices and worked through that legislation and have some amendatory language. So I want to thank all folks who have worked diligently on some concerns I had. I'll get the words out in a moment. All right, you ready to vote? All those in favor of sending House Bill 2451 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. All right, on the Leatherwood portion of the calendar, we're now on item number 12. House Bill 2452. You have a motion, sir, and you have a second. You're recognized for explanation, sir.
Thank you. And hopefully I'll be quickly through and done here. This is the end of my run. But this is a pretty straightforward bill as well. Our current law just says that children receive the vaccines as are recommended by guidelines of the Center for Disease Control or the American Academy of Pediatrics. What my bill would do is just change the last part of that. Child or children receive the vaccines as are recommended by the guidelines of the Commissioner of Health. And it wasn't my intention, isn't my intention, putting more responsibility or duties on the Commissioner of Health. Frankly, I would assume he would just rubber stamp what's already happening. Where this came to my mind, I'll share an experience from way back when, in another legislative lifetime. I actually had a bill that would say librarians cannot check out R-rated movies to minors. Seemed good on the surface. I never ran it as I looked at it. What we were doing was abdicating our governmental responsibility to a third-party, non-governmental entity. And what I mean by that is that the Motion Picture Association could have changed our rating to mean it's really good for minors. So the effect of our law would have been changed by a non-governmental third-party entity. And similar thing here, just bringing it back to being a governmental entity that has this final say or authority. And again, nothing stopping Commissioner of Health from just rubber stamping CDC or American Academy of Pediatrics. Yeah, I would expect them to do that actually. And once I filed this, I found out there are actually other associations that have information that the commissioner could look at. But anyway, that's explanation. Appreciate your support and take any questions.
Thank you. You've heard the explanation. Any questions or comments for the sponsor? Chairman Terry, you're recognized.
Thank you, and appreciate you bringing that and clarifications. I did speak to the Department of Health on this, and I know it's not your intent to have and to be more of a, I guess, like you said, a rubber stamp, or at least an overview of it. And so I know that they had some concerns with how it's currently worded. I think the concept is okay, and I don't know how to currently change that. But if this gets a positive recommendation for full committee, if the Department of Health can get us information that can clarify that for us, I'm assuming you'd be okay with that.
Yes, I spoke with them and other stakeholders, and I am open to just clarifying what I'm trying to achieve here. And I feel like in conversation, I addressed a lot of their concerns, but yes, I will work with them.
Thank you.
Thank you. Chairman Williams, you're recognized.
Thank you, Chairman Leatherwood. I just want to thank you for the bill. I think it's really important that we have Tennessee-specific rules and regulations as it relates to who we are, the cultural and identity of who we are as the state of Tennessee. I know that we just came out of one of the most tumultuous times as it relates to COVID vaccinations and treatments and all those kinds of things. And I think it would have been better for us to hear as Tennesseans what our Commissioner of Health was saying and what he was seeing in the research that he was seeing across the states, because there were many strains, many different things that were going on at the time. And I think it's really important for us to be able to drill down on what we think is best for our citizens. And I think what this bill would do would allow us to do that. I do think our current Commissioner of Health and future Commissioner of Health, regardless of their appointment confirmation, are the best people suited to make those decisions. And in this case, make those recommendations with informed consent. So appreciate you bringing the bill. Look forward to supporting it.
Thank you.
Thank you. Appreciate it as well. Further comments, questions? Seeing none, we're ready to vote. All those in favor of sending House Bill 2452 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you very much, Chairman Leatherwood. We're now going to item number 13 on our calendar. Hang on just a second, Chairman Hicks. And Chairman Hicks, I think we're working some amendatory language on your piece of legislation, as a matter of fact, and much like a bill we had a few moments ago, there may be an untimely nature of it that could very well get to be timely before we know it. You recognize, sir.
Thank you, Mr. Chairman. You are correct. So we wish to roll this to tomorrow's Hill.
All right. The request has been to roll House Bill 2060 to the Hill with the thought that we will take this bill up tomorrow afternoon. Without objection, that bill is rolled to the Hill. Thank you very much. We are now on item number 14 on the calendars. House Bill 2941, also by Chairman Hicks. You're recognized, sir.
Thank you, Mr. Chairman. And this is a
We have a motion. We have a second. Yes,
this
sir.
is a bill that we've been working on and still working with the department on it. But we have Kyle Duvall from Welcome Home Works, which is a great organization here, and he would like to come and testify and tell the committee a little bit about what they do and what they see moving forward for the state and recovery housing. At this time. Yeah, thank you.
Thank you, Chairman Hicks. And I know that you've been working in this space quite some time now, and appreciate the extreme effort that you've put toward this. We do have Mr. Kyle Duvall, who is with us. And we will go out of session at this moment. Mr. Duvall, if you could find the little red button that looks like a face on there, a speaking face, and push that. We'll get your microphone up and going.
Is it on? Yes.
Okay. If you could, Mr. Duvall, you've got 3 minutes. Tell us who you are, who you're with, and what you'd like us to know. And your 3 minutes will begin whenever you introduce yourself.
Well, good afternoon. My name is Kyle Duvall. I am the Deputy Executive Director of Welcome Home Ministries, which is a faith-based recovery housing community for men in the Nashville area who suffer from substance use disorders. I'm also the chairman of the Tennessee Alliance of Recovery Residences Advocacy Committee and represent TNR at the national level as a member of the National Alliance for Recovery Residences Advocacy Committee. The historical precedence for recovery housing best practices has been established for many years. However, it was on December 29, 2022, when the Excellence in Recovery Housing Act of 2023 was signed into federal law. The preamble of the act states, quote, clarifying the role of SAMHSA in promoting the availability of high-quality recovery housing. The act also requires the secretary to, quote, continue activities to identify, facilitate the development of, and periodically update consensus-based best practices, which may include laws for implementing suggested minimum standards for operating and promoting the availability of high-quality recovery housing. The act also mandates a federal interagency working group to develop a roadmap to achieve this goal. I was fortunate to be nominated by NAR and appointed to a SAMHSA advisory working group. In November 2023, the ASAM criteria, 4th edition, was published with a chapter devoted to recovery support services, including the high-quality recovery housing standards identified by SAMHSA. This was an historic milestone for recovery housing operators and treatment providers alike. Treatment is like putting out the fire, but it is recovery support services embedded in recovery housing with peer support in community and social supports that help individuals with a substance use disorder acquire the recovery capital needed to rebuild the house and sustain long-term recovery and self-sustainability. As you can see, the SAFE Act amendment for your consideration was not written in a vacuum. It is based on many years of research and consensus-based recovery housing best practices adopted by the American Society of Addiction Medicine, which is consistent with best practices identified in SAMHSA's Best Practices for Recovery Housing, published on October 23 and disseminated by HUD throughout the United States. What I have shared with you is only the tip of the iceberg, as Texas, Florida, Ohio, Virginia, and a total of 19 states have adopted the Recovery Housing National Standards codified in SAMHSA's Best Practices for Recovery Housing and the ASAM Criteria, 4th edition. Thank you very much.
Thank you, sir. Any question? Chairman Williams, you're recognized.
Thank you. Thank you for coming today. I just had
sir.
a quick question for you. If in my district 5 years ago, never had heard of addiction treatment facilities and residential properties before. Currently, I represent 3 cities in Putnam County. In Baxter, I have 12 of these facilities. In the city of Cookeville, I have 31, I think it is currently. And in Allgood, I have 7. They didn't, and everything's still good and all good. But the question is, it's a HUD ruling, I guess, that allows for these, but under the tenets of this bill, would these standards not be important as it relates to our constituents who may
absolutely.
have these addiction treatment facilities located in our own neighborhoods?
Yes, and what we need to differentiate is there is treatment. For example, at Welcome Home Ministries, we work with the Vanderbilts, the Cumberland Heights, and so forth, Buffalo Valleys. But once they finish the detox and treatment, then the recovery begins. And we are the 6 months to a year, if you will. They can stay as long as they need. And there are 4 different levels of recovery residences. So with the Tennessee Alliance of Recovery Residents, we have immensely grown, especially post-COVID. We have about 50 organizations either certified through the national standards as per the National Alliance for Recovery Residences standards, ethics, et cetera, and 2,063 recovery beds. Now, while that sounds huge, and it is, the demand is so great it's hard to keep up, because once they leave treatment, that's again the beginning. So we are what we call peer support, the recovery model of what they call social model, where you have to learn life skills. We have peer recovery support specialists to assist everybody. We don't call them patients, they're residents.
Mm-hmm.
But the ASAM, historical part of ASAM, in bringing this together, ASAM, there's a group called CARF, which is the Commission on Accreditation of Rehabilitation Facilities. They are the accreditation body for the ASAM criteria nationally. So there are approximately 7,500 physicians, nurses, and other professionals in the addiction field of medicine. So this is part of a continuum. So there's treatment, and then there's the recovery support.
Thank you. Well, I thank you for the work that you're doing. I didn't know if you had to estimate, based upon your experience, what percentage of your facility or those facilities, maybe in the state, meet these accreditation standards currently?
Well, that is another good reason for this amendment, because if we're not careful, there are organizations out there that even our residents call flop houses. And when you're under the standards as per the National Alliance for Recovery Residences, which has been adopted by ASAM, also the National Council for Mental Health, Well-Being, et cetera, and this interagency working group, as per the Excellence in Recovery Housing Act, all of them have solidified around these national standards. We definitely need them, like this amendment, tying it to ASAM, because if not, then if we're not careful, we have a bunch of, as they say, flop houses out there.
Thank you. Well, I'm fearful, based upon hearing from my constituents, that the majority of those houses in my community are what you would dub flop houses. My constituents are really concerned about that. I had one new football coach moved to town, bought his first house with his 3 daughters and his wife, and the house you described came up for sale across the street, and I get a call and says, I didn't know that there could be reduction or addiction recovery next door because the house was for sale, and they were. And so it brings a lot of concern, particularly when they don't see counselors coming and going, or an actual treatment going on. So I appreciate the representative bringing this bill. I think it's really important. I think it will be a good determiner of finding a way to find those good actors versus bad actors, those who want to have some excellence in what is they're doing and not just collecting reimbursement. But appreciate your testimony today. Appreciate the opportunity of the chairman coming to work on this. I look forward to seeing it sooner rather than later. Thank you.
Thank you, sir, and we'll be glad to work with you any way we can. Thank you.
Thank you. Any further questions or comments while we're out of session? All right. Mr. Duval, thank you very much.
Thank you.
Appreciate you. Seeing that, we will go back into session. And Chairman Hicks, just for clarification, just to make sure that folks know, we are on item number 14, House Bill 2941.
Thank you, Mr. Chairman. And
Let's put the amendment on the bill
Sure.
so we've got it in full consideration. The amendment is drafting code 015631. Have a motion? Have a second. All those in favor of placing House Amendment number 1015631 drafting code on the bill, please signify by saying aye. Aye. Any opposed, please say no. All right, your bill is amended and you recognize, sir.
thank you, Mr. Chairman. And you know, the gentleman is exactly right. Since COVID, there's been a lot of growth in recovery housing, and it's well needed. I mean, a 28, 30-day program really doesn't do someone justice if they go right back into the same atmosphere and where they came out of. So it's extremely important. In sitting here and sometimes, you know, we have to make decisions on the fly. I guess that's why we're here. So in sitting here and listening to the testimony, I think that what we should maybe do is let's roll this to the hill and see if we can't come up with some kind of, you know, the Department of Mental Health and Substance Abuse is working extremely hard on this, and maybe we can come to a compromise before we leave here, because it's a long summer and it's a long time till next year, and this could be extremely important moving forward. So let's just roll it to the hill, and we'll continue to work on it.
All right, you've heard the request of the sponsor. Roll the bill to the hill. Seeing no objection, House Bill 2941 as amended will be rolled to the hill of the calendar. Without objection. Thank you, Chairman Hicks. We are now on item number 15 on our calendars. The request has been sent to us on item number 15. House Bill 2291 is to take that bill off notice as per Representative Davis. Without objection, House Bill 2291 is taken off notice. We are now on item number 16, House Bill 2232 by Representative Freeman. You got a motion, you got a second.
Thank you, Chairman and Committee. I have an amendment that I would like to put on this bill. Drafting code 016094.
Well, the only problem with that, Representative Freeman, is it is untimely filed. And it is an amendment that we've seen a couple of amendments already in the posture of this committee. It is untimely filed. And we've got a couple of options. We can take the bill off notice, or we can roll the bill to the heel. I'm going to say that rolling the bill to the heel would be the better.
Perfect.
Let me clarify that. That's your only option. As I'm looking at,
I'm going to take option number B, roll it to the heel.
As I'm looking at where we are in terms of posture of this committee and our time to create another calendar.
Yes, sir.
In order to get your amendment properly before us and make it timely, we will roll House Bill 2232 to the heel. I think the sponsor understands and the committee is adoptive of that. Without objection, House Bill 2232 is rolled to the heel of the calendar. We are now on item number 17 on our calendar, House Bill 2328 by Representative Freeman. We have a motion. We have a second. I believe we've got some amendatory language that is timely filed on this one.
Drafting code 014729.
That is what we have. You've got a motion. You've got a second. Let's go ahead and place this amendment on the bill. All those in favor of placing amendment drafting code 014729 on the bill, please signify by saying aye. Aye. Any opposed? Please say no. The ayes have it. Your bill is amended and ready for discussion. Sir, you're recognized.
Thank you, sir. This is Title 63 cleanup bill. Tennessee Counseling Association brought me this legislation, and it does a few things. It adds licensed professional counselors, marriage and family therapists, and clinical pastoral therapists to the definition of medical practitioners under 63-1201. It removes the requirement the regulatory board shall have their annual meeting in July, allowing them some logistical flexibility in scheduling their meeting. It makes other technical and grammatical corrections throughout Title 63, Chapter 22. And with that, I stand ready for any questions.
You've heard the explanation. Any questions? Chairman Williams, you're recognized.
Thank you, Representative Freeman. Just a quick question. My community, actually my church, we have mobile healthcare clinics, mobile dental clinics that we provide free healthcare services. Under the revision of this bill, would it allow for our church facilities to get mental health providers to provide mental health services in a similar fashion? Is that what this bill does?
Yeah, I don't see why it wouldn't.
Okay, thank you.
Thank you. Any further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 2328 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman of the Committee.
Thank you. We are now on item number 18 on our calendars, House Bill 2275 by Speaker Pro Tem Marsh. The request has been to take this bill off notice without objection. Item number 18, House Bill 2275, off notice. We are now on item number 19 on our calendar. Item number 19 is House Bill 2297. Chairman Whitson has signed this bill, seen the signature myself, has asked Chairman Jernigan to carry the legislation for him as he is in a meeting at the moment. You have a motion, you have a second.
Okay.
Chairman Jernigan, I think we've got some amendatory language.
We do.
I think we've got drafting code 016682.
That's correct.
We have a motion, we have a second. All those in favor of placing this amendment on the bill for discussion, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. You are on your bill as amended. Chairman Jernigan.
Thank you, Chairman. Signed on to this bill about an hour ago because Sam's been called to the principal's office at the governor of the Capitol. So I'm going to let you know what this does. It's subject to appropriations. It's Part B of the Katie Beckett program to add 1,000 additional program participants to make it up to 5,000. That's what it does. I would appreciate no questions, but that being said, no, I've got a list here, but I'm happy to entertain some questions if need be. So.
Chairman Jernigan, I know that Chairman Whitson appreciates your carrying this bill for him, and we've all, many of us on this committee and others, have worked diligently on this, on the issues of Katie Beckett and the waiver therein, and understand that you did say subjects to appropriation. I know that there will be some challenges once this bill moves forward, that there are some challenges to appropriations on this particular issue, but it's very important. We have met with families on a regular basis, continue to meet with families on a regular basis, and hearing how we can make this program even better. And I think we've got some opportunities ahead of us, and this bill may be one of those opportunities there. Any difficult questions for Chairman Jernigan?
Yes.
Okay, no questions. All those in favor of sending House Bill 2297 as amended to full Health Committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward for Chairman Whitson. Thank you, Chairman Jernigan. We're now item number 20 on our calendars, House Bill 2933 by Chair Lady Littleton. The request has come to the chair that we want to roll this bill to the heel. House Bill 2933 by Chair Lady Littleton, without objection, rolled to the heel of the calendar. We're now on item number 21 on our calendar. Item number 21 is House Bill 2495 by Representative Chairman Hurt. Thank you. My numbers are giving me challenges today. Thank you for recognizing that, Representative Cheryl. Item number 21 is House Bill 2497. I'll read that one more time into the record. We are ready now for House Bill 2497 as I give Chairman Hurd an opportunity to get to the podium. You're recognized, sir. Do we have a motion? We have a motion. You have a second. You're recognized. And I believe that we do have an amendment drafting code 015303 for your legislation.
That is correct, Mr. Chairman.
Okay, let's go ahead and put that amendment on the bill. All those in favor of placing amendment draft code 015303 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended for discussion. Before you go forward, I noticed that you brought moral support with you to the audience. I will give you an opportunity for more than one reason to introduce the guest you may have with you. You're recognized, Chairman Hart.
Thank you, Mr. Chairman, and members and guests. I do have the better half with me today. So my wife, Dawn Hurt, is here for the day with me. Thank you. Appreciate that opportunity, Mr. Chairman. You saved me.
Ms. Hurt, as I recognize, I brought my daughter here for spring break last week, and she said she'd rather be at the beach. Was this an either or suggestion for you? So thank you for spending time, and thank you for sharing Chris with us. We appreciate the work that Chairman Hurt does. You are recognized for comments on your legislation, sir.
Thank you, Mr. Chairman. Members, House Bill 2497, with House Bill 2497, we were trying to solve some problems. Tens of thousands of adults with intellectual developmental disabilities in Tennessee, those who are not able to care for themselves, are living with aging parents. These adults are developmentally declining and generally isolated. Meanwhile, the parents worry about where they will go when they pass. We know this because hundreds of parents in Middle Tennessee and all over the country are pleading on behalf of their sons and daughters. Members, there is a way to provide an option. Currently, TCA 332418 limits occupancy of housing accommodations for persons with intellectual or developmental disabilities to no more than 4 persons and precludes any such housing accommodations from existing within 500 yards of each other. House Bill 2497, as amended, modifies the above reference code in a very limited manner. Some key components are: it seeks to protect persons living with intellectual and developmental disabilities. Its limitations have made adequate housing options inaccessible. The result is that many individuals are left at home either alone or with their family members, isolated from the community at large and not receiving the level of care and attention they need. This amendment establishes 2 pilot participants, one in the Western Grand Division and one in the Middle Grand Division, to provide persons living with intellectual disabilities and their families with safe and effective alternatives to the limited options currently available. Each participant must be tax exempt under 501c3, and each site must meet certain requirements relating to population and property acreage. No participant shall accept reimbursement from federal or state Medicare or Medicaid programs. Accommodations provided by participants must comply with codes and meet the following criteria: no more than 2 residents per bedroom, room sizes of 125 or 280 square feet, depending on whether the room has 1 or 2 residents. Each room is adjacent to or across the hall from a bathroom with a sink, toilet, and shower. No more than 2 bedrooms sharing 1 bathroom. No less than 100 square feet of common space per resident. Residents will be provided with a dietary plan and prepared meals. The proponents of this bill also offer or intend to offer comprehensive and individualized program plans, IPPs, emphasizing opportunities for recreational and social activities inside and outside residential community, as well as education, life skills, training, and employment coordination. Applications will commence on the effective date and are due on or before December 31st, 2024. A qualifying participant's application shall be approved within 30 days of receipt. The department will periodically collect and analyze resident data and progress, as well as gauge satisfaction from parents, guardians, and health providers. Annual reports will be submitted to both the Senate and House Health Committees. The department may neither authorize additional pilot participants nor expand the number of participants in each division. And with that, Mr. Chairman, I have some guests here that are would like to speak on it, if you would allow.
Thank you. And we do have some folks signed up to speak. Any questions before we go into recess? Or comments? All right. We will begin. Once again, we're on House Bill 2497. We will go out of session. And we have several folks on the list. We have an individual we have Park Pepper here with the Bador Center, and we have Mike Carnes, Kathy Stallworth, Lee Rose, Dan Corley from a Brightstone organization. Who would like to begin? Thank you all. And as we've stated earlier, just to make sure we are out of session. All right, just to make sure. We will begin, as you've heard us in earlier parts of testimony today, we will begin with you introducing yourself, telling us who you're with, and what you'd like us to know. And we'll go forward. It'll be 3 minutes for each of you. There'll be opportunity for questions and answers after that, but we'll stick strictly to the 3 minutes. So, gentlemen, you look like you're most prepared. If you can introduce yourself, tell us who you are, who you're with, and what you'd like us to know. You're recognized.
Thank you, Mr. Chairman, and thank you, committee members. My name is Mike Carnes. I am the chair of the Brightstone, and with me is Lee Rose, the CEO, and Dr. Kathy Stallworth, who's also a board member and a parent. We are here to bring an innovative solution to a huge problem. We have a massive number of adults with intellectual and development disabilities in Tennessee who are home with their aging parents. And as the parents get older, it becomes harder for them to take care of these adults. And even more, what they worry about is what happens to them when they pass. And we bring you an option, actually two beautiful options, Brightstone in Middle Tennessee and Gloriana in the West Tennessee. This does not replace the existing law and creates exceptions for two pilots. And the reason for the pilot program is it gives us the ability to place these homes within 500 yards of each other, which helps facilitate the needed services. Brightstone is an ungated community located a stone throw away from downtown Franklin, where adults are intentionally active in the community. You can see we have an incredible day program that is now in the 25th year. We just got licensed for 2 residences, and this bill will allow us to add more. You may have heard some misinformation from people who don't know us, and we get it. There were some bad situations many years ago, but we are home building. Homes of 4 with a house manager. We are not warehousing, nor institutionalizing, nor segregating. In fact, just the opposite. We continue to follow and exceed DIDD licensure regulations. Our adults have jobs in the community, will grocery shop there, eat in restaurants, and enjoy activities throughout the local community. And we are not asking for any state or federal funding, all private pay. So if there is any issue, the parents have a choice and they pull their child out. Also, we appreciate Governor Lee and Maria's support when he spoke to over 100 community leaders on our campus, and Maria volunteered that day. In conclusion, what I would like to share is that I have a son who is 26 years old with autism, and I'd absolutely have him in one of these residences, and I believe you would too. Thank you very much.
Thank you. We'll now recognize Mr. Rose. You're recognized, sir. Please tell us who you are, who you're with, and what you'd like us to know. You're recognized for up to 3 minutes.
Thank you so much for the opportunity to be here today. Is my mic on? Thank you for the opportunity to be here today. My name's Lee Rose. I'm the president and CEO of Brightstone. I've had the privilege of serving with this population for over 17 years, or coming up on 17 years. It's been my life's honor. I'd just like to lend a statement to say I urge you to consider the voices of countless families in our community who seek nothing but the best for their loved ones with intellectual and developmental disabilities. This bill isn't just about policy. It's about granting families the fundamental right to choose the care they believe in. I'm asking you, let us unite in compassion, recognizing the profound impact of this decision holds on the lives of those we serve. As a veteran who served our country honorably, I deeply respect the authority vested in you, our Tennessee elected officials. By approving this bill, you're not just passing legislation, you're answering the prayers, granting hope, dignity, and a brighter future for those who need it the most. This decision is about recognizing the worth of every individual and empowering families to choose the best path for their loved ones. We are committed to ensuring our residents have meaningful access to the community, dispelling any fears of isolation. Please let us work together to make this vital change for our community. I thank you.
Thank you, sir. And now, Dr. Stallworth, Kathy Stallworth, you're recognized. Again, tell us who you are, who you're with, and what you'd like us to know. Try one more time on the microphone.
Okay. Thank
There
you,
we
Mr.
go.
Chair. Thank you, committee. I'm Dr. Kathy Stallworth. I am a physician specializing in physical medicine and rehabilitation. Taking care of people with disabilities has been my life's work. And you might want to know why it's been my life's work. It's been my life's work because at age 19, my brother Philip was in a car accident and sustained a severe traumatic brain injury. My family is one of those families where my parents passed away before Philip did. What we found when he moved to Tennessee to live with me was that he was lost. We looked at the options available for housing. I did not feel comfortable as a family member. We prayed about it. What we found was Brightstone. Brightstone gave Philip a life. Now, I understand that there is a big push to integrate people into the community, and I understand that. And Philip was fully integrated in our community. But what Brightstone gave him was a group of peers, a group where he belonged, where people understood his unique challenges. And it meant the world to him, and it meant the world to our family. And ever since that time, I have been very passionate about being involved with Brightstone and about the work that they do. And I'm happy to entertain any questions, both as a family member and as a professional in this world.
Thank you all very much. Questions or comments for the presenters? I do have a quick question. And you mentioned, Dr. Stallworth, you mentioned the integration into the community. Can you tell me some of the things that your brother did and the experiences that he has?
Absolutely.
Excuse me,
He was first of all, we have an amazing group of people in this community in Middle Tennessee specifically. I know throughout the state, but I can speak for Middle Tennessee. People who embrace our adults with intellectual and developmental disabilities. He was a member of the Dolphins swim team. He was a part of the Special Olympics. He was very involved with outings through Brightstone. We have these wonderful songwriters nights. He would be up on stage helping to raise money for Brightstone. He was so passionate about it. The Brightstone students give back to our community. I really encourage you all to come sometime at Christmas time. They do a Christmas concert at the factory. He was very involved with the community, very loved throughout the community. And in no way did I ever feel like he was segregated or isolated. I felt that he was supported and integrated.
Thank you. And I've, in my years of service, we talk about working in this space and that space, and I've been in this space for 20 plus years, and as many of our members on the committee have, and it's been incredibly informative, some of the work that I've done, and as we look at person-centered opportunities for individuals receiving these services and this care, I'm always struck that families need to be given options and opportunities and options. And to me, it sounds like this is one of those options. It certainly sounds like that is one of those options to me. To the gentleman, anything you'd like to address to the question I posed about integration?
If I could, thank you for asking the question. I think that's a key piece. Brightstone is very intentional in the community. Our adults 5 days a week in our current day program and our residential program as it comes on board continues. It affords the opportunity for transportation to job exploration. We have a program called PATH, Preparation and Training for Higher Ability. We go to places like Soulshine Pizza, The Well, Grace Works Ministries, churches, and many missions that we work at. Their adults are given job exploration opportunities to be part of the community. We also welcome hundreds of volunteers. I can tell you that last year over 500 volunteers came around our campus from various businesses and church organizations. Brightstone is very intentional about going to the library or going to Chick-fil-A, and we're very proud of that to make sure that our adults are in the community being seen and not being hidden in any way. So there's lots of opportunities, and we open the doors to the public to come and visit and to be. I invite each one of you, take a short drive down to Franklin, Tennessee. We're a half a mile outside of the city limits. We're 2 miles from downtown Franklin, and this beautiful piece of property is 140 acres that we've been gifted and blessed with by our community. In addition to that, I want you to know that this 140 acres is not to be fully developed. In fact, we have already a master plan that we presented and has been approved by our county commission to allow us to build the homes and the facilities that we would like to do. And when we build those, we'll build those when the community leans in. When the community provides the funding opportunities for us, we'll continue to build and stand up more homes. There'll eventually be a chapel event center, a store that our residences or that our adults could work in. We have agricultural components. We work alongside other nonprofits in our community. One of those nonprofits helped us with our gardening operations. Our agriculture and horticulture kicked off last year. ACT, which is Autism Career Training Center, another nonprofit, occupies one of the residences on our property, again, expanding the reach and offering additional services to families within our Middle Tennessee community. So I welcome you, and I pray that you'll come and just take an opportunity to see for yourself of what we do not need to fear. Thank you.
Thank you very much. Any questions or comments further? Thank you all very much. Thank you so much. We also have with us from the ARC of Tennessee, Robbie Faulkner. Hello, Ms. Faulkner. If you could please, I think you've heard me make the statements before. If you could tell us who you are, who you're with, and we've got 3 minutes for you to have a conversation, then unlimited time to discuss after that. You're recognized, ma'am.
All right, thank you. As you said, my name is Robbie Faulkner, and I'm the executive director of the ARC Tennessee, and I am the mother of a 29-year-old son with autism. The ARC, as a nationwide organization, was founded to promote and protect the human rights of people with intellectual and developmental disabilities, IDD, and to actively support their full inclusion within the community. Our commitment to these principles has guided our work for decades. This bill proposes a pilot program that would allow an exemption from the state's anti-institutionalization protections in order to build congregate segregated residential facilities. The pilot program moniker, however, is a bit of a misnomer because this is an old idea. For decades, our state operated large-scale congregate and segregated residential facilities for people with IDD. These were the sites of horrific neglect and abuse heaped upon our state's most vulnerable citizens, and these tragedies occurred out of sight, out of mind because they were congregate and segregated. Our state, as well as the nation, eventually recognized the harm of these facilities and transitioned to the provision of home and community-based services instead. And with these community-based services in place, we've seen our IDD community prosper, getting jobs, living independently, and thriving in lives of their own choosing. In order to protect the progress of Tennesseans with IDD in their communities, our state enacted a firewall, laws that say no facility may house more than 4 people with disabilities, and that facility can be no closer than 500 yards from another residential facility for people with disabilities. These protections are absolutely vital. I do recognize that many families and individuals with IDD are currently struggling to find viable residential options. I also recognize that this bill does not call for a state institution. I am 100% positive that these organizations have the best intentions and that their current day programs are well run and meet the needs of their community. What I am concerned about is the erosion of our state anti-institutionalization protections. The IDD community, as well as the disability community as a whole, has relied on this firewall for decades to ensure inclusion and integration within the community. Without it, I fear for our progress and our state's progress. During this legislative session, I have sat on many committee meetings, and I have heard proposed bills and proposed amendments to bills that I thought were wonderful ideas. But often I would hear a committee member ask, if we say yes to this group, who will be the next group to ask? If we get involved here, where will we draw the line? Chairman and committee members, that line has already been drawn for us by legislators who saw what happens when we segregate people with IDD. We are asking you to please hold that line. Do not give congregate and segregated facilities a home in Tennessee. Thank you.
Thank you. Chairman Williams, you're recognized.
Thank you. Thank you for being here today.
Yes, sir.
Quick question. If I have a 100-acre farm
Mhm.
and I wanted to put one residential facility on every acre, I could
Mhm.
only do 2 or I could do 100.
Well, you're asking me to do math. So,
I'm asking you that because what I'm trying to figure
Yes,
out is
sir.
it capped at 2 or is it the distance that separates them? So could I have 100 of them 500 feet apart,
500 yards.
500 yards apart? Could
Yes,
I have
sir.
100 500 yards apart and it still meet the current statute?
With no more than 4 individuals.
That's what, yeah.
Yes, sir.
That's what I thought. Thank you.
Mhm. You're welcome.
Thank you. Further questions or comments? I'm stalling momentarily. I think we may have a question coming your way. Do we have one from Chairman Jernigan? Chairman Jernigan, you're recognized.
Oh, great. Yeah.
Or not?
No, yeah, I was, and I spoke to the group that came in my office, and I struggle. I understand, and like Chairman Hawk mentioned, and he had Greenville, and I had Clover Bottom in my district in Arlington, and there's a history that is tough to get over, of at least in the past, of hey, we're going to put them here, and that's just where they're going to be. And so we got to integrating the community, in which I would love to see homes in there. I do share. I know he said that it's not, it doesn't consider segregated. Just by definition, if they're all in one spot and they're all individual disabilities and no other, that's segregation. It's a step. I think what you're talking about. So I appreciate your testimony. I guess the questions that I have further is for the sponsor, Chairman. So thank you for coming and testifying.
Thank you.
Thank you, Chair. Okay. Thank you so much. I think we're going to go back into session. We have some questions for the sponsors, and our time is quite limited. So forgive me, there is a position of neutrality from Jolene Sharp in the Tennessee Council on Developmental Disabilities. There's been a position of neutrality. Would you like to share anything with the committee? Okay, we do have a few moments, and we are up against the clock in terms of several of us having to go to Finance Committee in a few moments. So, yeah. And the other folks have done really well, staying way below the 2 minutes. So we'll, or excuse me, the 3 minutes. So no pressure, but I will recognize you. If you could tell us who you are, who you're with, and what you'd like us to know.
Strategy Officer for the Tennessee Council on Developmental Disabilities, and I am also mom to two kids with disabilities, one with autism and one with Down syndrome. So I'm here wearing both hats. As you mentioned, we officially take a neutral position, but we are here to express some concerns about the impact of this bill. And as my colleague at the ARC so very eloquently expressed, there has been a line drawn very intentionally in our policymaking in this state because we understand that when people with developmental disabilities are housed together in a congregate setting like this, there is a great deal of control that they do not have over their own lives. And we've talked some this afternoon about choice. And what I want to say this afternoon is that we hear from people with developmental disabilities themselves. And what they tell us is they want support to live lives of their own choosing as part of the broader community. We, most of us today understand the importance of inclusive education. We know that students with disabilities benefit from living and learning alongside peers without disabilities. And we understand the dangers of lowered expectations and limited opportunities in segregated school settings. And those principles don't change after school. In adulthood, life skills are learned through living, not just training. And job skills are learned through working alongside people that may be more ahead of you in the chosen career. People with disabilities need to have the opportunity to make their own decisions about how to spend their time, not to fit with a program, but to fit with the lives that they are choosing for themselves. That requires sometimes even taking risks and learning from mistakes. This can feel incredibly difficult to navigate and downright scary for parents like me. The challenges that the families before you have expressed are very legitimate. We have work to do, but Tennessee has invested heavily in home and community-based services to support lives in the community for people with disabilities. More work needs to be done to strengthen those services and make them work for a wider range of families. But our state will be strongest if we stay committed to seeing people with developmental disabilities as essential members of the broader community. It is critical to maintain the policy barrier that protects that vision. And I want to say that our council stands ready to continue to partner with this legislature, with our sister state agencies, and with private organizations and the disability community to strengthen our service system toward that vision. We believe that progress is possible when we use our combined public and community resources to keep us moving forward. And the last thing I'll say is it's easy to paint a very different picture for what's being proposed as compared to some of the public institutions that we're familiar with. But what I want to remind us of is that the vision for the advocates who first advocated for those institutions had a vision not very different from what you're hearing this morning. And I want to emphasize that the issue really here is to make sure that people with developmental disabilities have the maximum possible agency over their own lives and have choice to live in their communities as they tell us is their preference.
Thank you. Thank you so much. Any questions or comments for the speaker? As we up against the 3 o'clock hour, you recognize Chairman
Really,
Jernigan.
really quick. So would you think that an inclusive model on a campus would be more in line with what?
Yes, we would advocate that people with disabilities be living alongside people without disabilities in an integrated setting community. Yes.
Thank you.
Thank you. Thank you very much. Thank you, Ms. Sharp.
Thank you so
Appreciate
much.
We are back in session. We have some questions for the sponsor of the legislation. Any comments before we go forward to questions and answers? Chairman Hurt.
Thank you, Mr. Chairman. And a lot of good discussion, a lot of good information today. We do have someone else that we would like to speak on behalf, and I know we're out of time, Mr. Chairman. And with that, could I ask to roll this to next week, to the Hill? Till tomorrow. Y'all meeting tomorrow afternoon?
Chairman Hurd, in full transparency, would you like us to transparency? Is your would you like to pick up tomorrow afternoon? And I'll look at Chairman. Pick up tomorrow afternoon at the point where we are on this piece of legislation tomorrow afternoon. You're recognized.
Thank you, Mr. Chair. If possible, if that's possible, yes, sir, that would be a great spot to pick up and move
Okay.
through.
All right, committee, the posture we're in, it is past 3:00. We are on item number 21, House Bill 2497. The motion is going to be to recess, which will allow us to pick this piece of legislation up when we begin back after full health committee tomorrow. Looking at a nod of the head from the full committee chairman, I believe that's a posture that we'll be able to take. And any objections? Okay. Chairman Terry, you're recognized.
And thank you. And just know that if we finish health before the allotted time, then we will be starting health sub. So expect to be there earlier than 5:00.
Yes. And for all those that, any questions from any committee members as we move forward, and folks that are looking again, fully transparent, the members will all be there. So thank you very much. The motion will be for a recess to begin again immediately following health full tomorrow afternoon. Without objection, we are in recess.
Thank you, Mr. Chair and committee.
Thank you.